You got some background there. We're asking people to please mute your microphones. You may have to move your cursor or your mouse for the mute and chat box buttons to become visible on your screen. If you could all mute, thank you. This presentation is being recorded and will be made available later. Today's agenda items include introductions, AARP advocacy meetings and process, AARP at the federal level, Colorado state issues, budget, utilities, Colorado Secure Savings Plan, healthcare, pharmaceuticals, and then we'll address questions. We'll start with introductions. Today's panel includes both AARP staff and AARP volunteer advocates. Bob Murphy has extensive private and public sector background, including 22 years serving the residents of Lakewood, Colorado as planning commissioner, city councilor, and mayor. Bob joined AARP as Colorado State Director in 2016. Kelly Fritz is an associate director with AARP Colorado and is the legislative advocacy representative. She works with the advocacy volunteers to promote AARP goals at the state level. Kelly joined AARP in 2001. Leslie Kalishman is vice chair of the legislative advocacy team and spent 37 years as a licensed clinical social worker in both medical and behavioral health settings. She currently is a member of the Palliative Care Conference Steering Committee for Metro State University in Denver. Bill Levitz is the lead volunteer utilities advocate for AARP Colorado and had been consumer counsel representing residential customers before the State Public Utilities Commission. A.W. Schnellbacher is an AARP Colorado volunteer advocate and was a member of the AARP State Executive Council. He retired after 30 years with the U.S. government, 27 years spent with federal Medicare and Medicaid programs. And I am Mary Fries. I'm a retired physical therapist, clinician, and administrator with practice areas focusing on neurological conditions and with frail older adults. That wraps up introductions. So next on the agenda is AARP Advocacy Colorado, excuse me, volunteer meetings and process. The AARP Colorado legislative advocates are volunteer lobbyists registered with the state of Colorado who work on behalf of those aged 50 plus. Most advocates are retired and many professions are represented. We serve as nonpartisan advocates in areas of healthcare, utility infrastructure, housing, retirement benefits, transportation, consumer protections, and many issues that don't have a defined category. Always important are the issues of strengthening Social Security and other retirement savings efforts, promoting adequate and affordable health care, and fostering livable communities. During the legislative session, January through early May, advocates meet weekly as a group to review legislative bills, discuss emerging issues, and plan lobbying actions. When a bill is introduced to the group, individual advocates sign up to be on a small team that will work that specific bill. Could everybody please mute? We're getting some background noise. Thank you. You may have to move your cursor or your mouse to see the mute button appear on your screen. Between meetings, team members research aspects of each bill, track the bill through the legislative process, and report back at weekly meetings to provide updates, foster group discussion, and facilitate the position that AARP will take on the bill. Positions include strongly support, monitor, which means we're keeping an eye on it, oppose, and strongly oppose. Occasionally, we'll take an amend position when we are lobbying for specific changes to a bill. For bills that we take a strong position, strongly support, strongly oppose, or amend positions, team members on that bill will testify at House and Senate hearings, usually accompanied by a gaggle of advocates in the gallery dressed in white AARP shirts to show support for AARP testimony. Additionally, advocates are in contact with legislators, are outside House and Senate chambers lobbying on specific bills, and work to educate the community via various media outlets. We celebrate all holidays, and this photo was taken at a weekly meeting during Mardi Gras, Personally, it feels great to work for the benefit of others in our state. And the best thing is working with the people on the team. They're dedicated and fun and serious about the work. And there's a great team feeling. If you are interested in joining the advocacy team, please contact Kelly Fritz at kfritz@aarp.org. That's KFRITTS at aarp.org. Next up, Bob Murphy is going to talk about AARP at the national level. Bob?
Thanks, Mary, and welcome everyone. And by the way, I'm playing a dual role of admitting people to this in my role as host. So if I seem distracted, that's what I'm doing. In any case, thanks again for joining us. I'm going to spend just 3 minutes talking about AARP advocacy at the federal level, and in doing so, highlight 4 key areas. Number 1, Social Security. Number 2, our response to the coronavirus pandemic. Number 3, our voter engagement campaign. And number 4, our response to concerns about the U.S. Postal Service. So first and foremost, of course, Social Security. Protecting and enhancing Social Security is and always has been a pillar of AARP's advocacy work. And particularly since the president's early August memo suggesting that he'd like to see a cut in payroll taxes, we've been hammering home that message. Social Security is an earned benefit. It's not an entitlement. It's a program that workers have paid into our whole lives. AARP will never stop fighting for this promise that must be kept, and any effort that puts in jeopardy will be met, in jeopardy will be met with fierce opposition from AARP and our 38 million members. Our CEO, Joanne Jenkins, wrote an August 13th letter to the president, asking him both to explain himself on the payroll tax issue and explain how he will protect Social Security for all of us. We've also met with the Treasury Department and Congress, and I think, as we all know, in general, that effort is pretty much going nowhere now. Happy to answer questions later on that. Secondly, our response to the coronavirus. The first thing we did way back in March was also Social Security related. In a matter of just a day or so, we quickly got the original CARES Act amended so that Social Security recipients could also receive the $1,200 stimulus check. That was not part of the original legislation. Since then, our focus has been on the situation in our nursing homes, where over 76,000 people have died from COVID nationwide. Our lobbying at the federal and state levels has focused on transparency, reporting cases and deaths, on adequate PPE, adequate paid staffing, adequate testing, and very importantly, the capability of visitation by loved ones. We got involved early here with the Polis administration. I'm always careful to give them high marks for their response, including the formation of an executive level rapid response team that met daily for 3 months and continues to meet 3 times a week. And particularly their visitation policy that's evolved from none to virtual to our visitation, now to indoor visitation, with criteria, of course. The third thing I want to touch on quickly is our National Voter Engagement Campaign. It's in high gear right now, and we have multiple goals. First of all, we want to remind the 50 plus to cast your ballots. Second, we want to let candidates know the importance of the 50 plus vote. We are the most reliable voting bloc in America, and a subset of us that are AARP members is even more reliable. And I'm just going to get one more person here. There we go. So we also, thirdly, we want to let the candidates know about the issues that are important to us as a 50 plus. Those issues are protecting Social Security and Medicare, lowering prescription drug prices, and health care, particularly with the pandemic and all of us wanting to be safe from the virus. Colorado is what we call a target race for the U.S. Senate race here, so we're conducting statewide polling and engaged in other activities, not in support of a candidate, of course, but just letting people know how candidates stand on the issues. Finally, briefly on the U.S. Postal Service issue, we're as concerned as many Americans are about the capability for the post office to ensure timely delivery of ballots, especially here in Colorado, since we're a mail-in state. Our Executive Vice President, Nancy Lamond, wrote an August 17th letter to the Postmaster General. I've spoken personally with Secretary of State Griswold, and our key message to Colorado is vote early. If you're going to use your mail-in ballots, find those ballot drop-off boxes in your county and get your ballots will drop October 9th. Vote early. Thank you. We'll answer questions later.
Thanks, Bob, for the national level view. For those of you listening, if you could put your microphone on mute, you might have to move your cursor or mouse to find the pop-up button for the microphone and click on that to please mute so we don't get background noise. Thank you. Next on the agenda are Colorado state issues. And I'm going to start with an overview of the Colorado budget in the year of COVID-19. The 2020 legislative session started on January 7th and was rolling along. The Joint Budget Committee, or JBC, had already prepared its 2020 through 21 fiscal year budget recommendations for the General Assembly to consider. Then the legislative session was suspended on March 14th due to COVID-19. Soon the economic impacts of COVID-19 became clear, with projected general fund revenues decreased by an estimated $4.3 billion, about 16%, for fiscal years 2019 through 20 and 2020 through 21. With an estimated $3.3 billion shortfall, the budget needed to be reworked. During the adjournment, JBC members identified, considered many budget balancing options, cutting tax loopholes, transferring reserves, applying federal COVID-19 money where permitted, but mostly having to make budget cuts. After a 10-week hiatus, the legislative session resumed on May 26th. Short 3-week session focusing on high priority legislation. Many bills were taken off the table due to fiscal impacts and time constraints of the shortened session, but finalizing Colorado's 2020 through 21 budget was a priority, with the fiscal year just a month away, beginning on July 1st. Some items cut from the budget are on a slide. The 2020 through 21 state budget is $30.3 billion and reflects cuts of $3.3 billion due to revenue shortfalls secondary to COVID-19. Some cuts are K through 12 education, $621.5 million cut, higher education, $598 million cut, Department of Transportation, $50 million cut. State agency personnel services were cut by 5%, and that's salary, health, dental, et cetera, to state employees. PARA, the Public Employees Retirement Association. In 2019, a law was passed to shore up PARA, with the state providing annual payments into the program. The 2020 through 21 unfunded liability payment of $225 million from the state was deferred. Not cut was the senior disabled veterans homestead exemption, and this was accomplished by a lowering of the general fund reserve to $162 million. So $162 million was not cut from the homestead exemption. The legislative session ended on June 15th with JBC warnings that budgeting for 2021 through 22 fiscal year may be a harder process due to further economic consequences of COVID-19. There is also a ballot measure, Prop 116, that if passed would also decrease income to the state. The JBC is scheduled to meet on September 18th, that's this week, to start its work again. Next on the agenda is an update on utilities, and for that we go to Bill Levis.
Thank you, Mary. AARP actively supported passage of Senate Bill 20-130 requiring increased disconnect protection through the State Public Utilities Commission for residential utility customers. This is especially critical during the COVID-19 pandemic. The PUC will be adopting rules on the issue this fall. AARP helped defeat several bills that would have increased utility company profits in an era of declining costs and would have raised residential utility rates. AARP was an active party in Xcel's electric and gas rate cases this last year, and those cases resulted in a 75% and a 40% reduction in what the company had requested, as well as substantial reductions in what Excel could have earned in the electric case. In that case, the reduction was over 10%, and it was 7.5% in the gas case. Also, AARP was instrumental in keeping fixed monthly charges in the gas case at $12 after Excel advocated increasing them to $15 a month. AARP also worked directly with Excel and the PUC staff in making notice of any rate increase going forward more understandable to customers and giving consumers more information about how they could protest proposed increases to the PUC. AARP was instrumental in getting customers time to analyze their electric usage, and as a result, giving them choice whether they wanted flat or time of use rates as Excel converts to smart meters. Smart meters are expected to begin being installed in Excel territory in 2021, with time of use options being available in 2022. AARP continues to work against Colorado joining a multi-state regional transmission organization that would increase rates and move oversight from the State Public Utilities Commission and municipalities to the Federal Energy Regulatory Commission. And finally, AARP supported passage of House Bill 20-1293, which transitions the 911 emergency service platform from an analog to an internet-based system, providing texting and video calling throughout the state. Presently, texting is not available throughout the state under the analog system. To facilitate the service, to promote safety and decrease outages, AARP also supported a statewide charge in addition to that from the local authorities. And that's it.
Thanks, Bill. Bill has been working triple time this year representing and protecting consumers on utilities issues. Up next, next on the agenda is the Colorado Secure Savings Program. The creation of the Colorado Secure Savings Program has been a high priority, with AARP Colorado strongly supporting legislation over many years to promote a better quality of life for retirees. On January 2020, AARP advocates met up with State Treasurer Dave Young. Treasurer Young has been a key promoter of Colorado Secure Savings legislation. In 2019, SB 19-173 created the Colorado Secure Savings Plan Board to study approaches on how to increase retirement savings for private sector workers. In February 2020, the Plan Board presented its report, which was the basis for this year's implementation legislation. The report also found that the cost of doing nothing would cost the state $10 billion over 15 years, having to use safety net services. For those of you listening in, could you please mute your speakers? You can do that by moving your cursor and clicking on the microphone button. Thank you. Colorado Secure Savings Plan legislation in 2020, SB 2200, created the implementation of Colorado Secure Savings Program. Some highlights include a Colorado State facilitated program for private sector employees who don't have a retirement savings program at the work. The program is run by private sector professionals with state oversight via the Secure Savings Board. Employees will be automatically enrolled in the plan with 5% of their earnings deducted from their paycheck and placed into their individual retirement account. Employees can increase or decrease their percent savings deduction or withdraw from the program altogether. Monies are pooled and accounts are professionally managed with low fees. The account is tied to the employee, so it is portable from job to job and can be used when an employee works multiple jobs. It will have a strong financial education component. The current status is that by September 15th, tomorrow, the governor will appoint the implementation board that will develop the program and execute the implementation. This board will be chaired by State Treasurer Dave Young. The implementation board is a public body that will hold public hearings, receive comments from the public as the implementation process moves forward. That was a big win for us this year. Next on the agenda is healthcare legislation with Leslie Kalishman.
Good afternoon, folks, and thanks for joining. AARP's first legislative priority for healthcare is the protection and maintenance of Medicare. Colorado has approximately 881,108 Medicare beneficiaries. However, nearly 50% of AARP Colorado's constituency are in the 50 to 65-year age group, and unless disabled, do not yet qualify for Medicare. Many of these folks are still working and may not have health insurance coverage through their employment, or may be underinsured with large copays and deductibles, which in essence makes healthcare unaffordable. AARP supports affordable and accessible healthcare. Some other highlights of legislation this year include House Bill 20-1236, which was the Healthcare Coverage Easy Enrollment Program. This bill allows Coloradans to request or to opt in on their state income tax return for the state health insurance exchange to determine whether underinsured household members are eligible for free or subsidized health coverage. Those who ask to have eligibility assessed under the program will receive information about coverage options and assistance with enrollment. We strongly supported this measure, and this was passed and signed by the governor July 6th of this year. Some activities related to the COVID-19 health emergency. We are very concerned about the impacts of the coronavirus in residential care facilities. We did outreach to our congressional representatives, urging Congress to support critical needs related to nursing home residents, family of residents, and staff. These critical needs included transparency of information regarding incidents of the virus in the facility, increased access to PPE and testing for facilities, enhancing virtual visitation for resident and families, and enhanced facility patient communications, involuntary transfers and discharges. House Bill 20-1425 was the hospital patient visitation rights during COVID-19. The act acknowledges the challenges to our state's healthcare system caused by the virus. The act encourages hospitals to follow infection prevention protocols and to work on identifying ways to improve patient visitation policies. We supported this bill, and it was passed and signed by the governor June 29th. Senate Bill 20-205, sick leave for employees. This bill had two parts. Part one came from Federal Emergency Funding and Legislation, the Emergency Paid Sick Leave Act, in the Families First Coronavirus Response Act. All employers in the state are required to provide their employees paid sick leave for reasons related to the virus through December 31st of this year. The federal legislation provides funding for free coronavirus testing, 14 days of paid sick leave for American workers affected by the pandemic. It covers time spent in quarantine, time waiting for a diagnosis, and time ill. Employers receive refundable tax credits on a one-to-one basis to offset the costs of providing emergency paid sick leave. Part two is the Healthy Families and Workplace Act, which starting on January 1st, 2021, the act requires certain employers to provide paid sick leave to employees accrued at 1 hour of paid sick leave for every 30 hours worked, up to a max of 48 hours per year. AA supports paid sick leave, and this was passed and signed by the governor on July 14th, 2020. Senate Bill 20-212, reimbursement for telehealth services. This makes more types of care eligible for telehealth insurance reimbursement, And we supported this bill, and it was passed and signed by the governor July 14th, 2020. House Bill 2014-10, COVID-19 related housing assistance. This concerned assistance for individuals facing a housing-related hardship due to the pandemic, and in connection, transferring money received from the federal government from the CARES Act to the Eviction Legal Defense Fund and the Housing Development Grant Fund to provide assistance. The act provided eviction assistance, rental assistance, residential mortgage assistance, and guidance on other housing assistance to households facing financial hardships due to the pandemic. AARP supported this bill, and it was passed and signed by the governor June 22nd, 2020. The advocates and AARP have had some additional concerns related to COVID-19 economic impacts on senior services and programs. The Older Coloradans Act, which is Colorado's version of the Older Americans Act, supports state and county level services and programs provided through Colorado's 16 area agencies on aging. We call these the AAAs. The AAAs provide essential information and services to seniors, including the most economically and socially vulnerable. The goal is to allow folks to age in place as much as possible, and these services include information and referral services, mobility assistance programs, meal services, and housing options, case management services to assist seniors and families in gaining access to services, individual counseling support groups and support for caregivers, respite care, supplemental services such as homemaking and personal care, enabling individuals to remain in homes and communities as long as possible, and certain gathering places, for example, some of the senior centers. Now, funding issues for these important programs predate COVID. The state funding projections for the 21 to 2022 budget are of great concern to us, presenting the possibility of cuts in these essential programs and services. And protecting these programs are a priority for AARP. Thank you.
Thanks, Leslie, and to AW, who are part of Team Healthcare, the group of advocates that works on healthcare issues. Thanks, Leslie, for that overview, especially on COVID. It was interesting. And to AW Schnellbacher, who will be fielding healthcare questions shortly. Next up is a review of pharmaceutical bills. I'm going to talk about 4 pharmaceutical bills. The first is an implementation update on a law passed in 2019, and the late night photo shows a part of that process. SB 19005, Canadian Prescription Drug Importation Program. This act aims to decrease prescription medication costs by importing meds from Canada, working within parameters set by the federal government. The U.S. Health and Human Services Agency's deadline to complete the drug importation rules has slipped to December 2020, so Colorado's final program request will likely occur in early 2021. Of note within this program is the possibility of expanding the program to nations beyond Canada, which leads us to the next bill to talk about. This year, SB 20-119, Expand Canadian Prescription Drug Import Program. PI just stands for Postponed Indefinitely, which means the bill died, like many bills in the shortened COVID session. So like the 2019 bill, this bill aims to lower drug prices by allowing the importation of prescription meds from nations beyond Canada. Again, the U.S. Congress must pass legislation authorizing such expansion. HB 20-1050, Other Outlet Pharmacies Drug Distribution. This act allows registered pharmaceutical outlets to make a casual sale or a loan of prescription medications to another registered outlet when a facility experiences a shortage. This is important so that these healthcare entities can obtain medications if there is a local site shortage. and HB 201232, Equity and Access to Clinical Trials in Medicaid. This act authorizes Colorado's Medicaid program to cover routine costs associated with phase 1 through phase 4 clinical trials. The Medicaid patient's treating physician determines that the patient has a qualifying disease or condition and that the patient meets the selection criteria for the clinical trial. This bill is particularly important for folks who have exhausted routine treatments for life-threatening illnesses and conditions, allowing them to have access to clinical trials regardless of income status. And now we're going to take questions from the chat box. If you would like to ask a question, please type it in the chat box. You may have to move your cursor or mouse for the chat box link to become visible on your screen. And Kelly will read the questions aloud and delegate them to us for who's going to respond to the question. Do we have any questions in the chat box?
Not yet, Mary. I'm looking. I hope
Okay.
somebody's going to ask us a question.
I'm just gonna chime in here real quick in this hyper partisan time and talk about AARP as a nonpartisan organization. I think some people have misconceptions about AARP advocacy. AARP is nonpartisan in that at the national and state levels, it does not endorse nor does not make contributions to political candidates, political parties, or PACs. Advocacy is issue-driven, based on AARP policy positions for the benefit of people 50 years and older. Sure, legislation is partisan in that voters select their representatives who enact legislation, but when AARP advocates look at a bill, it's about the merits of the legislation and not about the party who may be sponsoring it. So share that with your friends. Advocacy work is done on a nonpartisan basis for the benefit of those 50 years old and older. And that's a big scope because some grandparents are raising grandchildren. So we're here working for you. Just my little soapbox.
Thank you, Mary. We do have a question from Paul. Hi, Paul. Does AARP have any recommendations on ballot issues? Bob or Mary? Why don't you start that, Bob?
Sure, I will. And again, this is Bob Murphy, State Director for AARP Colorado. There are a number of ballot issues, as you know. It always we're a ballot and initiative state, so we certainly, first of all, advise everybody to study them carefully before casting your vote. Check out the Blue Book information when that arrives in your mailbox. As an organization, AARP Colorado, we are only taking, we're going to take a position on just one ballot issue, and that is the paid family leave. That's known as Initiative 283. It's on the ballot as Proposition 118, and we are going to be taking a position of support on that issue. Other than that, we're not supporting or opposing any of the other issues on the ballot.
That's a great question, Paul. Thanks for asking it. Let's see, we have something here from Phil. In 2019, the legislature passed an adjustment to the vendor fee, adding revenue to the state. It was intended that the revenue would go to address affordable housing in Colorado. The revenue was diverted from the intended benefit. When will the funding be applied to the intended benefit? That's a great question, and I don't know that we can officially answer that. We'll probably have to get back to you, Phil, if you'd like to send us an email and with your, let me know your information and we will get back to you on that. I don't know that we followed the vendor fee bill. I don't recall that one. Anybody in our team? No.
No, I don't believe we did. And Phil is certainly well known to us as a past mayor of Littleton and a member of the Colorado Senior Lobby. So we'll, it's not something that we really took a position on. So we're just not equipped to answer the question in detail.
We don't know everything. As hard as we try, there are literally hundreds of bills that are introduced every year at the legislature. And we don't have the ability to really weigh in on everything. We don't have policy to weigh in on everything. So anyway, we try to track everything as best we can, but that one I don't think was one we tracked. So. Other questions? Otherwise, we're going to let you go free today, like early.
I wonder if the chat function is difficult for folks. Do we want to try
You want to try to raise your hand?
verbal questions?
Good idea. Good idea.
AW hasn't even had a chance to speak yet. Okay, so when you raise your hand, just so you know, there is a little button to raise your hand. If you see it on your thing, it says raise your hand. I do see you, Jacqueline, and I will get to you, but there is also a function on there to make sure I see it.
Picture of a hand. There we go.
Yes, there you go. Jacqueline, take it away.
Okay, and it says couldn't raise your hand, so I don't think it wants me to talk. I just have a question. I came in late, but we talked about drugs from Canada, which I think is kind of established that those are generally safe, because we're familiar with those. But if we're opening that up to other countries, are those going to be screened as far as the safety? I feel pretty safe with most drugs that come from the US or Canada. So I'm wondering what the process would be. That's probably part of that bill, but I don't know.
I can answer that, Kelly. This is A.W. Schnowbacher. The answer is yes, they are safe. Most of those drugs are manufactured in those countries anyway, and they already come into the United States through our pharmaceutical distribution centers, and they are checked by the health officials. So yes, and if the bill reads that they will be checked, so safe.
Great, thank you.
And let's see, we do have a question here from Donna. First, I will get to that, and then I'll get to Phil's next question. Donna asks, when we report items to the AARP fraud line, what happens? What does AARP do with that information? And I'm going to give that to Bob. That's a great question.
Yeah, and I want to say hi to Donna as our first guest. She was in on the previews as we were getting ready for this meeting. Yeah, so it depends on the nature of the fraud of the fraud question. They are oftentimes referred to the Attorney General's office here in Colorado, and sometimes, depending again on the nature of the question, to our national office. So everything is followed up on. We have actually an app that we use called Frontline. If you ever want to download that and use it, but we certainly try to respond to Frontline within 24 hours. And if you don't have that app, we still forward that concern on either to Fraud Watch, which is our own internal AARP fraud division, and they are housed in our office building downtown when we're actually working in our office building downtown, or to the Attorney General's office.
Thank you. We have our next question from Phil. Do you see the AAA funding growing in the older Coloradan population? It seems that the 2022 budget will have even more cuts. I know I have opinions on that, but I'm going to just see if AW or anybody else wants to take that. Otherwise, I'll chime in.
Yes, I will work on that, Kelly. We are very concerned about those cuts. And those are one of the things that we have lobbied for years. We have been able to get increases, but now we're going to have to defend the amount of monies we do have in there. So it is a real issue. Those funds are extremely important because they do help people out of institutions. And if we don't have additional funding for that, then we're probably going to pick it up in institutions with things like Medicaid. So yes, we do worry about it, and yes, we will be working on it.
Thank you, AW. John Rodwick is asking, the Gallagher Amendment is going to be on this year's ballot, one of the most complex issues. Agreed. Can AARP provide information to its members to help them understand the complexities so we can make a decision to approve or not? Either Bob or Mary?
We haven't gotten our blue book yet. Amendment B, repeal property tax assessment rates was referred to the voters by the state legislature by SCR Senate Continuing Resolution 20001. Passage would repeal several constitutional provisions regarding property taxes in the 1984 Gallagher Amendment. The likely outcome is that property taxes will be raised to provide local funding for fire protection, police, ambulance, hospital, K-12 education, and other service, and will be used to avoid an automatic mill levy increase. AARP Colorado took a monitor position as this resolution was going through the General Assembly, and we have not taken a position on this initiative.
Thank
And
you.
John, I'll just add, as you indicated, it's a very complex issue. Certainly, the Gallagher Amendment has kept residential property taxes low since it was passed in 1982, lower than comparable states. The argument can certainly also be made that it's created a very unlevel playing field, particularly outside of the Denver metropolitan area and outside of urban areas. In smaller school districts, fire districts, library districts, water districts that just don't have either the revenue stream or the capability or flexibility that the larger districts have. So it's a tough question. As Mary indicated, more likely than not, approval of this would raise residential property taxes somewhat, but it's one of those kind of big picture things where we're asking people to do their homework and then vote your conscience.
Any other questions out there? Again, don't be shy. This is your chance to interact with us. Let's see. Oh, I don't see any other questions. Anybody else? I don't see any other hands raised. Well, I guess with that, we are very appreciative of everybody taking the time to join us today. Do be checking your email. We have several things happening throughout this cycle and that we want to share with you. So we look forward to a further conversation. Again, if you're interested in joining our advocacy efforts, again, we have a lot of fun. It's not all work. So I do encourage you to email me if you are interested in that, or if you have any other questions or whatever. Again, my name is Kelly Fritz, and my email is kfritz@aarp.org. Anyway, so thanks everybody. Have a great day. Again, this is recorded, and we'll see you later.
Thank you
Bye-bye.
very much.
Thank you.
How do I get out of here? I don't know.
You should be able to hit leave up at the top, or at least that's the way it is on my computer. It's a red button that says leave, in case you're wondering.
Really?
See you tomorrow.
See you tomorrow.